And we continue our conversation with Dr. John Schneider, soon to be president of the Wisconsin Psychiatric Association. I want to turn to the drug problem we have in this country. National Institute on Drug Abuse shows the Midwest saw opioid overdoses increase by 70% from July of 2016 to 2017. Growing problem. Is there a connection between drug overdoses, drug overuse, and the shortage of mental health professionals?
There's not a connection per se. A lot of the problem related to prescribing habits around OxyContin and how pain management was approached, and then changes to try and fix that created the explosion of the drug problem. The fact that we don't have enough providers makes it very hard for people to get timely treatment.
And what about, where does alcohol abuse fit into this whole picture?
It's a major problem. Wisconsin has a very large problem with binge drinking, and even if we do an excellent job with the opiate problems, Wisconsin is going to be left with some binge alcohol problems that we still have to work on.
And in this day and age, we oftentimes see that people who can't get to professionals like yourself, the problem winds up in the laps of law enforcement.
It can. Wisconsin legislature has done a number of what are called the HOPE initiatives, and they have done a number of reforms to make treatment easier. They have a number of ways that people can get Narcan, or naloxone, which is the antidote for opiate overdoses, so that people are less likely to die of an overdose. They decriminalized reporting an overdose. There's lots of incidents where people are using drugs together and a person overdoses, but they don't want to be around when the police arrive because they're afraid they're going to get tagged for a felony offense. So that was one of the things that Wisconsin, Representative Nygren and the previous Attorney General Schimmel worked very much for to roll back some of the punitiveness of some of the laws to make it easier for people to call for help and or get into treatment in some ways.
Doctor, kind of an umbrella question. We have this shortage of mental health professionals, psychiatrists. How did we get here? What happened to our society? What happened to our world? Why are we in this position where so many people need this kind of help?
I don't know that there's a simple answer because it's a complex problem. On the supply side, as we have done a better job reducing fear of getting treatment, more people are seeking treatment. At the same time, we have an aging population, so that professionals are retiring. If we look at other medical specialties, general surgeons, about half of general surgeons in Wisconsin are over the age of 50 also. We have not increased the number of medical education positions to create advanced practitioners since about the 70s very much. So those two things together account for the gap.
Let me turn to domestic abuse. We've got highly trained counselors in our shelters across the state, and again, same question, do we have enough of those for these shelters?
I don't know specifically about the shelters as it relates to all the licensed professionals, starting from nurses to licensed independent social workers, to therapists, to psychiatric nurses, to psychologists, and psychiatrists. All are in tight demand. It's a growth industry just with more people seeking treatment, more people having insurance, and we just have to improve the training programs to create more. There is a program UW a number of years ago through their School of Public Health and Medicine created some additional residency positions to build people and create people to have an interest in the psychiatry in rural areas. They've been doing that for a number of years now. The Medical College of Wisconsin, in cooperation with all of the major health systems in the northeastern region and north central region, opened 2 new medical schools and 2 new psychiatry residencies. They should be graduating their first class in a year. And there's clear data that when people train in the community, they stay in the community after they complete their training. So this is a way not only to get more psychiatrists in Wisconsin, but to get them in the northeastern and north central areas that are some of the most underserved.
How has this shortage affected the care of our veterans?
The Veterans Association, or the VA system, has had the same sort of hiring and recruiting problems that other. One of the challenges is with the way physician care is reimbursed. When you have a specialty in short supply, the amount people have to pay for salaries to recruit them gets higher. And public sector, whether it's county, whether it's federal, whether it's state, it makes it more challenging to get good talent and keep good talent. The VA in particular, and Milwaukee County where I work, has focused on finding people that are aligned with the mission, people that want to care for veterans, that are interested in veterans issues. If you recruit them, you can find them. Same thing with the county. We look for people that want to work with the population we serve. And in many cases, because they really have it in their heart to work with the population, they're willing to take a little bit less or work a little bit harder or have a little bit different benefits set up than some of the big health systems offer.
Dr. John Schneider is our guest, and we will continue our conversation right after this. Stay with us.